Good morning to everyone, ladies and gentlemen. I present the Center for Demographic Research that is unique in Moldova and has large activities in the domain of social and demography. Today's presentation explores how Moldova is confronting a growing gap between care needs and care capacity, and how public social services are responding to this shift. I will present findings of recent analysis that are based on evidence from the statistical data and sociological surveys realized in the last years. Also on some evidence and estimation based on demographical projects done by Center for Demographic Research. This evidence, estimations refers to the growing number of the old people that will need all the time care all the time. Okay. This slide illustrates a dual crisis: rapid aging in Moldova and large-scale immigration. In last decade, Moldova has seen the fastest growing increase of the share of the population 65 plus, and as you see, is the highest increase in all Europe. On the right hand, the map shows that most districts in Moldova are lost between 10–17% of their population due to international migration between 2014 and 2020. And this migration is based on the age working population and youth. As a result, many older people, adults, are left alone, especially in rural areas. The situation is more critical, with little or no family support. But in the general, you will see that family support in Moldova is maintaining, but their capacity is declining. And here we see also the fastest growing of the old age dependency ratio in Europe, that Moldova also has this evidence. And based on forecast of our center, is estimating that the dependency ratio will increase to 42%, and the most changing are in the structure of the old age population. And as you see, the projections are emphasized that the 70 plus age segment will, which is the most dependent and care intensive, will grow dramatically from 31% to 38%. Meanwhile, we have here double pressure, because more older people who require care will rise up, and fewer working age adults available to provide this care or informal professional care is go down. According to household data, a significant part of households are headed by the older person, and you see that it's more than 35%. In rural areas, this share rises to 41%, and alarming is that 6 in 10 elderly households consist of single person, and another 28% only 2 persons that represent older couples. Intergenerational co-residence is now the exception, not the rule. And this also is a result of mass migration and family fragmentation. While in other European countries, single living may reflect autonomy, and we have a lot of indicators like active aging index, where single living is like indicator for capacity to be independent. In Moldova's case, marked by low income and poor health access, especially in rural area, and high migration, is often signals exposure to neglect and unmet needs care. And also the HBS data shows that for older people, life satisfaction is declining now. More than 31% said that they are living worse than the previous year. Here, based on the previous data of census, of population and household census realized in 2024, we see functional limitation among older people, and a big share of that functional limitation. According to that data, 24% of people aged 65 reported serious mobility difficulties. 18% have vision impairments, and 9% experience hearing loss. And over 5 struggles with memory and concentration. It shows the capacity of older people aged 65 plus, and also the HBS surveys shown that nearly 1 of 3 older people rate their health as poor or very poor. And here, relying on the previous data, it was interesting to know how old people is show or say about their self-sufficiency capacity, and relying on van surveys that was done in 2023-2024. We see here that most older people retain their independency in routine activities, but the share of those who need help increases in physical demanding activities, such as homework and gardening. We see that men in all age groups are less likely to do domestic activities, and this is independently, and this reflects stereotypes about domestic roles. In rural areas, is a great dependency on help for agriculture and household activities. and more requests for help begin to appear as is represented here in the, for those aged 65 plus with physical activities. And we see that the growing, the group 75 plus shows the greatest need for help, particularly with daily living and household activities, and is rising the share of people that need permanent help of personal care increase. And it's important to notice that the most frequent type of help that the relatives are presented to all the their old member included financial assistance, household management, some food provisions or medical provisions, also coverage of medical services. And as you see here, informal support, most of all the people rely on informal care, but support care, but support needs are shifting with age. We see that spouses and children are primary caregivers, and only a small share receive formal support. As you see, in total, 6% of people have had received formal support, and this share is increasing, especially with the aging in 75 plus age. Around 17% is receiving this support. We see that dependency rises with age, including unmet needs. And what is emerging here is not so much a decline in informal care, but it is a crisis of capacity. Families still care, but they simply cannot cover the intensity and duration of care needed, especially after 75 plus. And here we want to show these estimations based on demographic forecast that shows that the problem clear. The number of elderly needing permanent help. Here are the number of people who will need permanent help based on the previous empirical data, and we applied the forecast, demographic forecast here of the the number of elderly needing permanent help will almost, as you see, will doubled. Especially, it will be it emphasized the help needed for older age population in 75 plus. And here we have what our social services can't cover. And at the moment, there are a lot of activity that on the agenda of government. This problem is also prioritized, and some changes was done, but social services cannot cover all the necessity. And here we have the data that shows that more than around 15,000 of older adults received free home care, and One social worker assists 8 older persons, twice the recommended norm. In this time, we have a lot of major challenges in healthcare and social services, and last 10 years, it's emphasized the continuing decline in the medical workforce, increasing pressure and on the system. The number of geriatricians, particularly low compared to the needs of the aging population. Only 30 specialists nationwide, and in rural areas remain the most affected, with limited healthcare access due to severe infrastructure limitation. Also, current home care services are being scaled up, but it's still necessary to do some changes, especially for long-term needs. Meanwhile, as I said, it was done some developments in public social services for the elderly in the Republic of Moldova. We have national program on active and healthy aging by the year 2027. And this expanding access to service, strengthening institutional capacity, promoting lifelong learning, and based with collaboration with international partners. It was done at the University of the Third Age. We have 2 universities with of the third age. It was developed age-friendly environments. Almost 10 districts in Moldova had done their strategy on aging, their proper strategy on aging that have the objectives to combating ageism, including and give assistance of daily activities and healthcare. And as conclusion, nevertheless, we see that Moldova is facing a care capacity crisis, not just a demographical one. Informal care remains essential, but increasingly insufficient for long-term complex need. Public social services are expanding, but remain under-resourced and unevenly distributed. Structural investments in long-term care, workforce development, and regional equity is not longer optional, and it's essential. Thank you.